So this is a quick guide for anyone doing 3D lipo or cryo shock. Congratulations on your first treatment. You're officially on your way towards your goals and success is just weeks away. It's an exciting stage and we're genuinely looking forward to supporting you through the journey. This short video is designed to guide you through what is normal to experience after your session, how to look after yourself and what you can do to achieve the strongest and the safest results possible. What might you notice after a treatment? Well, after treatments such as cryolipolysis, which is fat freezing, or radiofrequency, ultrasound and shockwave therapy, it is completely normal to notice some temporary changes in the treated area. These reactions are part of your body's natural healing and metabolic response. So you may experience some mild swelling, some redness, bruising or tenderness, and these effects are common and usually settle within a few days to a couple of weeks, depending on the area treated and how large the area is, and your individual healing speed. With cryolipolysis in particular, some people notice temporary numbness or reduced sensation in the treated area. This happens because the cooling process affects superficial skin nerves and sensation typically returns gradually over several weeks and in some cases can take up to 2 months. This is expected and does not usually indicate a problem. If we're treating more superficial or frequently used areas such as your upper arms or your shoulder region, you may feel slightly more bruised or tender. These areas have a richer nerve supply and are used constantly in our daily life, so mild muscle sensitivity can occur. This should steadily improve as the tissue settles. You may also notice a feeling of slight firmness, a little bit of lumpiness or tingling or itching beneath the skin as your body begins processing the affected fat cells. This is a temporary phase of the natural elimination process. So obviously it's a non-surgical, non-scalpel version of cosmetic enhancement, and it is important to place these side effects into context. So while mild swelling and bruising or temporary numbness can occur with non-surgical body sculpting, these effects are generally far less significant than the risk associated with surgical fat reduction procedures. Surgery obviously carries higher medical risks such as infection, scarring, wound complications, prolonged healing time, and the possibility of non-healing tissue. And surgical procedures also involve deeper structural intervention, which increases the chances of long-term or even permanent nerve disturbance. In some cases also, surgical numbness can last many months or even up to 2 years. So with our non-surgical treatments, we're not working on deep nerves or internal structures, so any numbness that occurs is superficial and typically resolves over time. Our approach is designed to be minimally invasive, lower risk and supportive of the body's natural processes, allowing most people to continue normal daily activities without any extended downtime, so you can get back to work straight away. It's important to understand that there are key lifestyle consistencies that you need to take into consideration, so your results are not created by the machines alone. Consistency in lifestyle is essential, so maintaining the healthy eating plan, hydration levels and exercise routine discussed in your consultation and pre-treatment guidance is what allows your body to respond optimally. If the program is not completed as recommended or lifestyle habits are not maintained, your results will not reflect the full potential of the treatment series. Clinical experience and research show that weekly structured treatments are significantly more effective than isolated one-off sessions. So consistency produces more stable and longer lasting improvements in both fat reduction and skin quality. So it's important that you please continue to drink adequate water daily to support normal metabolic and lymphatic function, follow your balanced nutrition plan, maintain regular physical activity, including cardiovascular and strengthening exercises. Why the diet matters. It's extremely important to understand that your dietary choices directly influence how effectively your body can process and eliminate the treated fat cells. When these technologies disrupt the fat cells, your body must break them down and remove them naturally through the liver, lymphatic system and the kidneys. This is a physiological process that depends heavily on what you are putting into your body at the same time. If you consume a high-fat or heavily processed diet during this period, you're adding more circulating fat into your bloodstream while your body is already trying to clear existing fat cell contents. This increases metabolic load and can slow the elimination process. In simple terms, you're asking your system to remove fat while simultaneously supplying it with more fat to deal with. For this reason, it's strongly advised to avoid takeaway foods, fried foods, fast food meals and highly processed packaged products because these foods are typically high in unhealthy fats, sugars, preservatives and excess salt, all of which place extra strain on the liver and kidneys and the very organs responsible for filtering and getting rid of the fat you want rid of. Excess salt intake can also contribute to fluid retention and increased pressure on your kidneys. So when the kidneys are working harder to regulate fluid and electrolytes, their efficiency in supporting waste removal can be reduced. Similarly, the liver performs best when it's not overloaded with processed fats or chemical additives. So the most supportive approach is to focus on clean, fresh, minimally produced or minimally processed foods, ideally things that are fresh or local or lean protein sources, vegetables that are high in fibre and low in any refined sugars and saturated fats, and anything that's moderately low in salt. Locally sourced whole foods tend to contain fewer additives and more natural supporting ingredients with better metabolic efficiency, collagen production and skin quality. So in summary, the treatments start the process, but your nutrition determines how effectively your body can complete it. So it's important to understand about your safety and your monitoring. Your safety remains our priority at all times. If anything changes in your health, if you begin new medication, become unwell, or have any procedure that may affect your immune system or your skin integrity, you must inform us at least 48 hours before your next appointment so we can adjust your treatment if needed. For the most accurate tracking of progress, we recommend booking your sessions at the same time each week where possible. Body weight and fluid balance can fluctuate within 24 hours depending on nutrition, hydration and activity levels. So consistent timing helps us measure changes more reliably. So if you have, after treatment, any mild swelling, bruising, tenderness and temporary numbness, those are all classed as normal responses and usually are very short-lived. Non-surgical treatments carry significantly lower risks than surgical alternatives, and when combined with consistent attendance, hydration, nutrition and exercise, they provide a safe and effective pathway to visible and sustainable results. If you ever experience symptoms out with what has been described, or if you have any concerns, please contact us. We're here to support you throughout your entire treatment journey.